Hello, my name is Derek Brandon. I'm number 81, and this is my presentation on benefits of fitness. There are several benefits of fitness that can help adults both in health and disease. These benefits include skeletal and muscle functions improved by exercise, cardiovascular functions improved by exercise, metabolic functions improved by exercise, and psychological functions improved by exercise. Skeletal benefits from fitness include maintenance of mass and structure, constant physical activity maintains and increases the mineral content of the skeleton, exercise prevents osteoporosis and fracture, specific exercises like weight-bearing exercises can prevent diseases such as osteoporosis. Daily exercise in general can prevent fractures of the hip, wrist, and vertebrae. Muscle benefits from fitness include supportive functions are improved by strengthened muscles and joint stability. Tendon, joint, and connective tissue functions are improved by exercise. Regular exercise improves to maintain stamina, strengthen muscles, and improve or maintain the range of joint movement. Muscle benefits from fitness continued, which include lubrication in joints are improved by exercise, and the lubrication in joints can help avoid limitations of movement. Daily exercise maintains flexibility and range of movement, which helps limit the effects of degenerative arthritis. Exercise reduces risk of injury, especially with age and muscle disease. Cardiovascular benefits from fitness include cardiac performance work improves the effects of aging and prevention of chronic disease. High amounts of physical activity can reduce the individual risk of coronary heart disease and stroke. Arterial blood pressure regulation during exercise reduces blood pressure and mild hypertension. Cardiovascular benefits from fitness continue. The heart beats less frequently with improvement in aerobic fitness, thus the energy requirement of the heart muscle is reduced. Regular exercise creates electrical stability for the heart muscle. Cardiovascular responses to acute exercise reduces risk of cardiac arrhythmias, irregular heartbeat, and probability of sudden death. Metabolic benefits from fitness include control of body weight and regulates energy balance. Daily exercise prevents obesity-related disease and excessive weight gain. Constant physical activity prevents non-insulin dependent diabetes such as mellitus. Exercise can increase the insulin sensitivity, improve glucose tolerance, improve carbohydrate tolerance, and reduces the risk of diabetes. Metabolic benefits from fitness continue. Good metabolic control can still be achieved by diabetic patients who exercise. Exercise contributes to a more functional metabolic capacity and nutrient blood supply. Physical activity creates a better lipid and lipoprotein metabolism. Psychological benefits from fitness include physically active people are less likely than those who have sedentary, which is remain seated often, lifestyle to develop breast and colon cancer. Exercising can help exercises can help individuals' moods and reduce anxiety and depression. Improved self-esteem can be a result from physically active individuals. Psychological benefits from fitness continue. Memory can be improved through exercise. Calmness is also benefited from through fitness and can better improve stress-related conditions. Physical inactivity. The prevalence of physical disability attributable to age or chronic disease is high. Most people aren't able to exercise because of work, school, parenting, and old age. A high proportion of the public stands to benefit from increased exercise because so many currently take none. Physical inactivity continued. According to the results of the Allied Dunbar National Fitness Survey, showed that 1/3 of men and 2/3 of women would find it difficult to sustain walking at a moderate pace of about 3 miles per hour up to a 5% slope. The survey showed that people's rates of participation in active sports and exercise are low. About 1 out of every 6 people is sedentary, which is remained seated for too long, and reported no activities whatsoever of a duration of and intensity likely to benefit his or her health. How do individuals fix physical inactivity? To protect their cardiovascular health and function, a large proportion of the population must be motivated to abandon the sedentary lifestyle. Most individuals get the wrong idea about fitness and believe it is to be constant, vigorous workouts. But in reality, an individual needs a more than simple, moderate workout to sustain a healthy lifestyle. According to the Center of Disease Control and Prevention, the CDC, every American adult should accumulate 30 minutes or more of moderate intensity of physical activity over the course of most days of the week. Conclusion. Moderate to vigorous exercise equals healthier lifestyles for all adults. Healthy and active lifestyles need to be encouraged in every community. It is imperative that every adult gets an adequate amount of exercise weekly. Daily exercise will improve bodily functions and can help prevent diseases. What is the definition of sedentary? A, B, or C? Or D? Go.
C.
C. C. Tending to spend much time seated, somewhat inactive. 2. What type of disease is osteoporosis?
A. Bone.
A. Bone? Correct. Bone. 3. Which parts of the human body are associated with cardiovascular disease?
C. Heart and blood vessels.
C. Heart and blood vessels. Correct. 4. What does CDC stand for?
B. Centers of Disease Control and Prevention.
Correct. Centers for Disease Control and Prevention. 5. What causes type 2 diabetes mellitus?
D. All of the above.
Correct. D. All of the above. And that's the end of my presentation. Thank you.